Neither the El Paso Medical Society, its members, nor PBS El Paso shall be responsible for the views, opinions, or facts expressed by the panelists on this television program. Please consult your doctor.
In order to prevent the spread of the virus, we all need to do our part. One of the easiest ways to prevent that is by wearing a mask. In order for a mask to do its job, it needs to cover your nose, your mouth, and your chin. First, you should wash your hands with either sanitizer or soap and water before putting on a mask. Then pick up your mask by one of the ear loops to make sure that there's no tears or stains on the mask. If it is dirty, throw it away immediately. If it's intact, take both loops and put it over your ears like this, and then press down on the bridge of the nose to make sure that it fits and there are no gaps. Once you are done with the mask, please take it off the same way. Both ear loops, pull it away, and put it either in a Ziploc bag or throw it away if it's a surgical mask. If it's a cloth mask, make sure to wash it with soap and water and keep it dry for the next use. Do not put your mask down at your chin or above on your forehead when you are starting to remove it, as that just contaminates the mask. Thank you so much for doing your part to prevent the spread throughout the city.
That was Dr. Days, the mask tutorial rock star. Our first COVID-19 program was back March 12th, 2020. That was exactly 8 months ago to the date. And at that time, there was not one COVID case that was confirmed here in El Paso yet. What a difference 8 months make. So March 12th, we opened up the program at that time with these words: the fear of the unknown. It's a powerful thing, and it still is. But at this point, we know a lot more, but there's still a lot that we don't know. So some of the questions that we're going to be asking are, why do some people show symptoms? Why do some people don't? Why is it that some people who are showing symptoms, they're doing okay and they bounce back easily, but other people simply don't? It lasts for weeks, for months, and others obviously are passing away. This evening is something that we're going to be talking about, how the hospitals are responding to COVID-19, and also community partners, people that are coming into town that are helping out. So it's an update on how El Paso is responding to the rise of cases here in town. This program is live, like it always is. Call us. We've got two medical students here from Texas Tech Paulo Foster School of Medicine. The telephone number, 881-0013. This program is underwritten by the Hospitals of Providence, and we also want to thank once again Texas Tech Paulo Foster School of Medicine for providing the medical students with us today. We have Isa Rauf, and we also have Miral Garamsi, and they're going to be answering the phones, and then they're going to be texting me the questions. So if you see me on my phone every now and again, I'm not being rude. I'm just trying to figure out what questions they are that you are bringing my way. Good evening. I am Catherine Berg, and you're watching a special edition of the El Paso Physician. Welcome again. We have been 8 months since we've had a real update on what's going on with COVID here in El Paso. And again, I opened the program, if you just are joining us, back on March 12th. We didn't have any cases, and that was the first time we talked about COVID on this program. So there's a lot that we've learned. With us this evening, we have Nico, and don't you dare call me Nicholas, Tejada. I stole that from a very good friend of ours. He is the group CEO for the Hospitals of Providence. And we also have Dr. Kenneth Berumen, and he is the Network Director of Emergency Medicine. So we have someone who's talking about logistics, administration, everything that's happening all over town. There's been beautiful partnerships and people helping each other with all the hospitals involved. And Nico, thank you so much for being that guy. And Dr. Berumen, man, you're going to get all kinds of questions tonight. So it's going to happen fast, and we're going to try to get through most of what we can. I do want to throw out really quick a website that is updated almost daily, if not daily, and that is EP Strong. So just think of El Paso Strong, epstrong.org. That's where you will get numbers, what to do, how to get testing, what the numbers are right now. It's a great website to get all kinds of information. And also, if you are not a person who likes to get on the computer, there's also a hotline, a COVID hotline for the telephone, 212-6843. For those of you out of the 915 area code, the area code is 915-212-6843. So, on that note, it's a lot to cover, but Nico, I would love for you, because you're that guy, I feel like I've known you for a million years, and you've just come through the ranks at Hospitals of Providence, and not all that time, but talk about what you're doing all day, every day, kind of since COVID came into play. And you can take just a couple of seconds, couple of minutes. We're going to go into a lot of questions later, but just so that the people at home kind of know what questions to throw your way.
Sure, I appreciate that. First of all, thank you for allowing me and Dr. Baruman to be here. What I do all day is COVID, all day long. I mean, to put it quite simple, I have the easiest job in the hospital by far. People like Dr. Baruman and the staff are the ones in front of the patients, taking care of the patients every day. My job is quite simple. Make sure the team has the resources they need to do what they're trained to do. It's easier said than done, but we spend all day long working on that, me, my fellow CEOs, working with other CEOs in town to make sure we get those resources, working with federal agencies, state agencies, working with our parent companies, working with community partners. That is what I spend my time on. It's a journey of a lifetime, something I'm very proud of.
And I do have to say for the people at home, because everybody at home has a home life. Nico is a dad. He's got a 10-year-old and an 8-year-old.
Yes, I do.
And Mamacita and Papacita are over here, and there's homeschooling going on.
That's
so
right.
Please understand that everyone on this table feels that pain, as well as the professional stuff that
That's
we're going
exactly
through all day,
right.
every day. So I think that's so very important, because we want the audience to see you all as people, and this is something that you're dealing with. Dr. Baruman, all right. I want to say, so give us a little bit of your background prior to COVID, and then going into COVID of what you're doing all day, every day.
So I'm a native El Paso. I went to nursing school here at UTEP and then worked at Sierra. And then went to medical school some 9 years later, went to Parkland and trained at Southwestern. Came back, I was recruited back, and I've been here for now going on 21 years back.
Going on 21 years. So you were an expat, and now you're back.
That's right.
Anyone who's anyone comes back.
That's right, it's a great town.
It's a thing. I have to tell you, it's totally a thing.
I agree.
I'm going to fix something here on my computer. So what I want to do is go into the surge. I mean, we're not telling you anything that you don't already know at home. There's a surge going on. It's happening, yes, in El Paso. We're national news everywhere, but there's a surge all over the country, and there are surges in many pockets of the world as well. What I want to focus on today is not what ABC News is going to talk to us, the national news. I want to focus on what we're doing in El Paso. And Nico, I'd like for you to start that, because you kind of went into it a little bit about, you say you have the easiest job, but in some ways it's the most important job, because it's all about communication and access to what your people need. And on that note, going back to March and April, it's like, okay, we know more is coming. It was different. Then we knew there was going to be like maybe a little slow, and then come back in the summer, and we're hot and heavy now. So talk us through what you and members of your team, and how you've kind of talked with other people in El Paso. And then after that, we'll talk about the outside world.
Yeah, no, I appreciate that. It's been a journey. So you talk about my wife. You know, believe it or not, she was the first person to let me know about this thing called coronavirus.
Oh, goodness.
We were at home in early January. She woke me up one night and told me about this thing going on. And you know, like everyone else, you never quite take it as seriously as it was going to be.
Oh, I'm not on a cruise ship. I'm
yeah,
fine.
Exactly.
Yeah.
And then one thing becomes another, and she's proven right. It's this major issue we have to deal with. I still remember like it was yesterday, the first meeting I had with my team in the Hospitals of Providence to talk about N95 masks and PPE.
Right.
Because that was the first thing on the radar. And since then, it's been just such an interesting journey. Because at first, and like you mentioned it in March, there weren't any cases, but yet we were on a state of high alert. And then we went through some surges, but small compared to where we are now. But over time, cases have gone higher, but that state of awareness dropped until last month, when all of a sudden we saw the cases rise dramatically. And since then, I've been very happy to say that the preparatory work that went in between now and then has proven very effective. And we can get into it, I'm sure we will, with questions, but it's not just the Hospitals of Providence. It's UMC, it's Las Palmas del Sol, it's the city, it's physicians. We have done remarkably well of handling the surge. It's kind of hard to outrun the virus.
Right.
But all being told, I'm very proud of where we've gone.
Okay. I do want to, for those of you who haven't seen numbers as of today, I am going to go through some numbers so you can kind of see what on the administrative level, Nico and Dr. Baruman are dealing with. So currently, in the hospitals throughout this county, I don't know if it's through the county or just El Paso City, you might be able to tell me, but we have 1,148 people in hospital. We have 287 people in ICU, and of those 287 people, 204 of them are on ventilators. I'm saying that, going back to Dr. Days, it is so important. Yes, to wear your mask, but seriously, I just driving over here, I'm looking at parking lots of stores like Burlington, and I shouldn't say, I shouldn't have said that, now I'm going to get in trouble, but just in general, if you don't have to go out, don't go out. Really, and it matters to all of the people that you're working with. It matters to people who are on the front lines, and I say that, Dr. Baruman, I would love for you to right now to give the plea to people who are just in earshot of this show, of how important it is. If you have to go out, wear a mask, fine. But if you don't have to go out, don't. And I'll let you take it from there.
I think that's exactly right. There's so many opportunities for us to avoid going out now. There's the people that are doing stuff online, the deliveries for food, the deliveries for products. All those things are very much available to you. And yes, we miss going out and seeing our friends or our checkers that we always see, but right now is the time where we really need to clamp down. We're talking about limiting the spread that's already been out there, and the smaller amount of people that we expose or we get exposed to, either way, is slowly going to drop these numbers back down, where we can be much more under control.
Exactly. And that, on that said, I want to say that the last couple of days, we were going up and up, and the last couple of days we come down just a smidge. So there was that spike. We have Thanksgiving coming up, and Thanksgiving is that time to meet with people. On that note, when you're looking at, let's talk about the Civic Center. Maybe that's where my mind's going to go, and it's going to come back and circle here. So we have so many people in the hospitals that we are in El Paso setting up extra spaces for patients to be. How did that decision come to be, and who and how is that being done?
No, so you're absolutely right. On a couple of things. One is I can connect with you looking by the big box stores and seeing who is there. Just last night, my family and I, this is our version of a joyride now. We went out before curfew, and we just drove around all the stores just to see who's open and who's not, and who's behaving themselves.
Yeah.
Fortunately, El Pasoans are great at masking, but so we saw that. Anyways, back to your question about the alternative care site. Along the way, especially over the last 5 weeks with the state and federal agencies, we've received tremendous support on multiple levels. They've seen the data as quickly as we see the data. They saw that our hospitals had reached capacity, exceeded capacity, and now something else needed to be done. So,
and when you say they, who is they?
So
I think that's always the
that's a great
collective
question. So in this case, they would be the state of Texas, Governor Abbott's team.
Okay.
Saw what was happening here. Before the alternative care site was ever established, there were other resources granted to us. So like, for example, to date, there are over 1,300 medical personnel that the state has helped organize, and the federal agencies for El Paso. Most of those are nurses, but also it includes physicians. Physicians who are intensivists, ER physicians, hospitalists, are here in El Paso because those agencies have coordinated that for us. So they have always been doing that. Then they saw the numbers. They projected where the growth was going to be in the cases and determined an alternative care site, also known as a field hospital, was needed.
Right.
They came in very efficiently and established that field hospital. And I'll be honest with you, when I did that first tour of the site, and Dr. Baruman, you were there, I was talking to another physician there, and we looked at each other with two general impressions. One is, this is actually an impressive facility. The second one is, we can't quite believe we're living through this.
Yeah.
Because you see this in movies where field hospitals are set up, but here we are. But it was comforting to see the quality of it. And was it going to be 50 beds? We've already reached the threshold of 37 patients in that 50. Now they're going to be adding another 50 that should be available this Sunday.
That's what I heard last night. So that's going to be available by Sunday.
Yes.
So if you could describe what these beds look like, because I've seen some photographs and I know some people who are working on the projects, and we say beds, but each one of them is its own room.
I'll let Dr. Baruma speak to
Dr.
that.
Baruma, there you go. So
They're essentially a cubicle that's set up with the equipment that you need in a hospital room, essentially. And what it is self-sustained area where you would see a patient normally. We don't want to have very ill patients there. We want to have those that are stepping down, a little bit more controlled, limited oxygen demands. But we have oxygen, we have places for restrooms, we have places for you know, cleanliness, everything else. It's pretty much a self-sustained hospital.
And that's, we're already getting so many questions in here from the audience. And when you say self-sustained hospital, it's impressive because really you're walking into a whole different room and you're completely separated from everyone else. They're already asking about some vaccines. So I don't know, I don't want to jump ahead of ourselves. I would like to first talk about testing because I think that will be a better flow. I know that in the beginning, let's go back to March, because again, that's when the show was going on. We're like, hey, there's testing sites here, and then all of a sudden it was just overwhelming. And now, you know, you have different stories from different people. I mean, we all have friends. Oh, I waited 5 hours in line, and I waited 12 days to get my results, etc. So for people who are listening, what is the process now that's being, again, you go to El Paso Strong, I respect that, but since we're here on the air, what is the best way to get a test and the most realistic expectations that people will have on receiving the results? In the old days, all of my guests were over here, so I feel like whoever's on this side gets ignored. Dr. Baruman, I'm so sorry.
Not
It's
a
just like I'm
problem.
so used to looking this way.
Not a problem.
But since it's testing, either one of you can throw that out there. Dr. Baruman, do you want to take that on now?
I think the advantage we have is we have multiple testing centers around the city. And every day, it seems like almost every day, it seems to change and there has an added potential for extra. So the key is you're going to find out where can I go to that's closest to me and that's going to be the shortest wait for me. Now the times on these tests really can vary. Depends on how many get submitted at one time, you know, where these get processed. They try to turn it around as quickly as possible, okay? But I mean, that can vary dramatically just depending on the flow of the patients.
Yeah.
We try to get that back to the patients as quickly as possible.
So here's my follow-up question to that. And I don't know, and again, every patient's so different, which we're finding out. Incubation times, right? So there are people like UTEP's got its own testing center. If there are contractors there or people who are working at the Civic Center, there are contractors there. However that works, a test is administered when someone knows, oh, someone in the crew of 20 had COVID, so all the other 19 got tested. Do they do it right then? Do they take another test 5 days later? This is where it gets complicated because yes, I've been exposed. You know you've been exposed. You don't know how close. You don't know if somebody breathed on you. You don't know. But you get a test that day. But the question is the incubation period. Would the test be able to pick up that you were exposed that day? Or do you have to have exposures for a couple of days and then the test picks it up? I think that, to me, that's a question. People will ask me that question because they think, oh, well, you do the medical show. You know these things. I don't. I really don't. So however you can best explain when you can become positive after being exposed to someone with COVID. Am I making sense with the question I'm asking? Okay,
So
okay.
generally we think it's 7 to 14 days is
Okay.
what we think the incubation period is. The whole idea of getting tested right then when you get known you got exposed is, were you already positive? And have you exposed other people?
Right, okay.
So it's a part of contact tracing. Now 7 to 14 days is going to allow us to kind of see what the incubation period is. That's generally what we think. The other thing is, these tests are not 100%.
Right, exactly.
So you may test negative, and then 3 days later, test positive. You know, there's an error rate with tests. They're
Right.
not 100% perfect.
My follow-up on that then is, since there is that 7 to 10 days, if that person knows that they were exposed, should they automatically schedule a test for, say, 8 or 9 days later?
I say they quarantine is what they
Okay.
should absolutely do, is quarantine themselves.
Okay,
And then you can talk to your caregiver, whoever that is, and they'll help you arrange a test for yourself.
And if I could just
Okay, absolutely,
really
Nico.
add on to that, Dr. Berduman is right on. One of the most dangerous aspects of this virus is that it sheds itself before you're even symptomatic.
right. That's
So-
exactly the, okay,
So to his
yes.
point about if you think you've been exposed materially, you need to make sure you stay away from people, especially those who are at risk
Right,
populations. I will tell you that one of the biggest challenges about this is, and it's the truth, I talk to a lot of people, it's honesty. You don't want to admit that you might have not worn your mask.
so true.
You don't want to be that person who has, well, I knew I was supposed to stay 6 feet away, but I didn't. No one wants to be that person. So rather than admit it, you hope that you're not really infected, but that's how
Right.
problems occur.
right.
The other thing I'll add is we talked about testing. I just was listening to the latest report. over 530,000 tests have now been done in El Paso County.
Yes, yes. And so talk about, and many of those, not many, some of those are retesting.
Sure.
So let's talk about that because we've got a population of, I always think, 700,000. To me, I like saying that number.
Yeah.
So saying that we've got 3/4 of the population tested, that's not the case. There are people that get multiple tests.
That's correct.
But that's a good thing that people are actually getting comfortable with the fact that they need to go out and test. Dr. Baruman, I feel like this is so important. When you say the word quarantine, I would love for you to define that. Because some people think, oh, I'll just be in this TV room and everybody else can be in that TV room. Define that for people. I think that's so important because I think, oh, well, yeah, I was only in there for 15 minutes or 20 minutes
I
or
would say,
whatever.
think about all those people that you love in that house and who you would never want to expose. You're going to limit yourself to one room and stay in that one room, hopefully with a restroom or somewhere you can get to the restroom quickly. You're going to have one person bring you food and water and that kind of stuff so that you're not exposing the entire family, okay? So that's the whole key, is you really, quarantine means isolating yourself, okay? And the other thing is, when we talk about exposure, you should think like we think in the hospital. Everybody is positive.
Right.
If you treat everybody as positive, you're going to be a lot more cautious about how you interact with people.
I agree. And in my head, too, I've got an 18-year-old and a 23-year-old. I say to them, because in the early days, it was like, oh, the young kids, they're fine. In the early days, I said, pretend like you have COVID, and you're making sure nobody else gets it. And now, we obviously see it, and we'll go through the age for a minute, too. But go out there thinking that you could spread it to anybody. Because, again, you were talking about being asymptomatic. You could have it. You can have it shed. Like you said, it's shedding before you even become having symptoms. Nico, go, and then I'm going to start asking some questions.
You talk about people being trained for this. My sons, Nicholas and Alex, when I go home, they're trained now. They give me air hugs. They like run up and they stop.
That's what we do. We came in here. Hey.
Like, go wash up, Dad. Go wash up. But that's just the way things work now. And it makes me proud of them, though, because they know that we have to keep distance until things are safe.
Okay. I respect it completely. Questions here from the audience, and I don't know this question. I will make this disclaimer. So, again, there's so much it's not known. There's a lot of political stuff going on. We're not going to talk about politics. We're not going to talk about any of the political stuff. One of the questions here from the audience is for employees that are working in hospitals. If they feel that they're getting sick, they are immediately asked to go find a test and before they report back to work. And I guess the question is, what is that real protocol? So this is kind of a question from the audience saying, well, what is that exactly? So if somebody's feeling ill, they're getting tested right away, exactly. But what is the directive right now?
Sure. So when this all started, we put in strict protocols when you first come into the hospital. We do temperature checks and we do a screening. If you feel any symptoms, if you have a temperature, you don't come into the building to begin with.
Right.
You're to call the occupational health nurse, employee health nurse, and then that individual walks you through the steps. And what they'll do is look through your symptoms, look through your temperature, look through your risk stratification of who you've been exposed to. And that's very important because per CDC guidelines, if you have been exposed to someone for over 15 minutes in a 24-hour period within 6 feet without adequate PPE, then you probably do need to go test sooner rather than later. However, if not, they'll give you different guidance. So that's generally how we approach it. I will tell you that the CDC has always been changing its guidelines as it's been learning more. And as that happens, so do we.
Exactly. And I think sometimes, too, when people are like, hey, that's not what they said yesterday, it's because we are learning as we go.
That's exactly right.
As we go. Another question here from the audience. Again, we've got two wonderful medical students. Let me go to the other question here. Boy, part 3 in that question. I love it. I'm going to go up a little bit. No, that's not the biopsy. That was the last show that we did. So, can you demonstrate the correct way to wear a mask? I like that question. Of the 3 type of masks, which one is the best one to wear? How easily does a virus spread through the eyes? So that's a 3-part question. So first, let's talk about the first 2 questions. So we see people wearing the scarves. We people seeing bandanas. And Dr. Baruman, I'm sending this your way. What is the best mask to wear that everybody has accessible too? I mean, I see them everywhere. I mean, if grocery
So,
stores, et cetera.
The best mask, if you can still get it, are surgical masks. And there's plenty of those now being available. The other one would be a multiple layer mask. A single layer of material is not going to work. I mean, yes, it covers the face, but it doesn't catch the material. Something like I'm wearing is an N95. It has very tight seal. It has an electrostatic charge. It's what we use in the hospital. But the general surgical masks are generally well available. That's probably the best option, or a
And when you
multi-layered
say that,
mask.
we can take a picture of Nico's face.
Exactly.
There we go.
And what I see above Nico is he's got that nice wire on top because some of us have really beautiful petite noses and other of us have big old honking noses. So that can cover up really nicely. This is 3 layers right here. And so the bandanas and the scarves, I heard, and please correct me if I'm wrong, if I can blow out a candle, my mask is not good. Right? I don't know. This is one of those
I mean,
things.
that might be the case. The
Yeah.
whole idea is really you're blowing out virus and you may be sucking in virus. So that's the
Exactly.
whole idea.
Yeah.
And so the
And
tighter
these
you
gaps
seal,
up here and these gaps down here.
right? And people are notorious for bringing down their mask when they're wanting to talk. That's the worst thing to do.
Right.
Alrighty.
Absolutely.
I'll tell you, I will credit El Paso. I think New York Times did a study that
I took a
indicated
picture of it today. Yep.
that indicated we did better at masking than most communities. But that isn't really our challenge. Our challenge is we get around family and friends and we let our guard down.
Yeah.
And we take the masks off. We do great in public. It's when we're around our family, our mothers, our fathers, our siblings that we take it off. And that's what we need to
Exactly.
watch out for.
Because we just think
And I think
everybody's
that's
good.
exactly right. And when you're thinking about your families, that's when you should be most worried. And take the opportunity to call them, to do, I mean, there's so many different ways now with Zoom, with
Yeah,
FaceTime.
right.
And thinking about how you're going to protect those members of the family that you love. And it's really limiting their exposure. And yes, I know it's tough, but we will get through this, as we have every single other thing. We will get through this.
Should I tell my story now about my elbow?
Please.
So,
This is a good
yes,
one.
we shall get through it. So today, and this is something to hospital staff, it matters. If you have other issues going on that aren't COVID related, you still need to go check it out. I thought I was going to come in with a big bandage on me. If you check out this elbow, I've got this nice little golf ball hanging out right here. I have a sign in my yard that says, "This too shall pass." And about a month and a half ago, I went out there and I added the word eventually. And then I tripped on my garden light and fell into my. But the bottom line is I went today to get it checked out because it's freaky looking. And I thought, well, should I wait? It's COVID. We're really spiking right now. At the end of the day, this is a medical program. You all are medical professionals. You are in facilities that specialize in taking care of what's happening right now. So if you have a medical issue, Dr. Berumen, I'm going to throw it your way. If you have a medical issue, talk to the folks at home that if you, actually no, I'm going to switch this to Nico because now Nico has a story.
Okay.
Without revealing a name.
First of all, I love the fact that you showed that on TV.
Oh,
that makes me so
oh,
happy. That's
people know all
great.
kinds of stuff about me.
That's great.
I am like
I
all
love
over
that comfort
it.
level.
And that's why I'm wearing these sleeves today, because I thought I'd have to hide it. But you were
no,
talking about a friend of yours
You
that
told me your
telephoned you.
story, yeah, and a friend of mine who's very well educated, very informed individual in the community. He contacted me yesterday via email and said he felt like he was having a heart attack, and it's been going on for several days. But he was concerned that the hospitals were full, and he wanted help finally getting to the best hospital that had the most space. That scenario didn't exist before COVID. That person just came in.
Right.
Fortunately, in his case, it was okay.
Yeah.
He ended up okay. But there are many instances, and Dr. Berumen can tell you story after story,
Right.
of where it doesn't end up so well when people
Right.
delay their care.
Right.
Yeah,
And
this
let's
is-
talk about strokes, heart attacks. Let's talk about the symptoms that, yeah, right now you call 911.
All the time-sensitive stuff is extremely important to activate immediately. Don't worry about what you're going to meet in the ER. We know how to take care of you once you're there. The key is if it's something with your brain, a stroke, weakness, problems with your speech, problem with your vision, anything like that, that's new onset, you need to come in right away. For every minute you don't have blood to that part of the brain, you're losing 1 million neurologic cells. okay?
Right.
So it's very important for that. Chest pain. Chest pain can be any number of things. The worst being a heart attack.
Right.
That's also a time-sensitive issue. So anything that's time-sensitive, you need to come in for. That also means belly pain. The last time we had a spike, the numbers in our ER dropped dramatically. We weren't seeing anything but COVID. But what we saw weeks later was the appendicitis that had ruptured,
Yeah.
the heart attack, and now the guy's coming in with heart failure because he hadn't come in at the same time.
Right.
So the key is we still know how to take care of patients. We know how to separate those patients that are ill, and we still need you to take care of yourselves and come in for these time-sensitive issues.
Right.
Chest pain, belly pain, diarrhea that hasn't stopped in 4 days, something like that. You know when you're ill, and there's no reason to stay home. We can treat you correctly.
At the end of the day, the safest place to go is a hospital, healthcare facility, because again, you guys have got it going on. We were talking, Nico, I'm going to throw this way because it's just your turn. Question here from the audience is that everybody in my family has been tested positive for COVID, but nobody is demonstrating a fever. Is this normal? Great question, because again, we were talking about at the beginning of the show, some people really get hit hard and some don't. I know you're not a medical doctor, but throw that out there, because that's where you said people start letting the guard down. Oh, yeah, I tested positive, but I'm fine. Yeah, let's go have the barbecue.
Yeah, well, first of all, I'm happy for that family. I mean, they're very fortunate. My first question is, what's the age range of that family?
Right.
Is it a young family, or is it someone who's older?
My family and I, unfortunately, don't have any more information than that.
But what we've seen is, if you look at the statistics and you look on that website you told at the beginning, if you look at it, the vast majority of positive cases are people between 20 years old and 40 years old. However, the vast majority of mortalities, of death, are over 70.
Right.
So it's entirely possible that a young family, my family, for example, we wouldn't have any symptoms, or if they were, they'd be so slight.
Yeah.
But that's not the danger. The danger is that family then going around grandma and grandpa, going to a store, and maybe there's someone helping them at the store who's older. That's the danger that exists.
Exactly. You talked a little bit about numbers. We have the numbers here of patients recently, all 29 patients that we have here. They did not all occur in one day. It occurred in a combination of days. I'm not going to give you the exact dates, but out of 29 patients in about a 4-day, 5-day period, one male was in his 30s, one male was in his 40s, one male in his 50s. Then we start going up in numbers. We have 5 males in their 60s, 2 females in their 60s, 6 males in their 70s, 4 females in their 70s, 3 males in their 80s, 5 females in their 80s, and 1 in their 90s. So I know that was a lot of wording, but Dr. Baruman, question here, and this is something that came up a couple of months ago with somebody else. Females and males on faring better than the other, is that a thing? Is it seen that females, I don't know where I watch, it was a peer-reviewed medical article that I was reading, however, because I really try to only read those, because be careful on the internet, really be careful on the internet. But in general, males, females, is that a thing?
I don't think there's enough data out there to help us decide this stuff. There are so many different variables, even with specific populations. And the issue is that this is an evolving disease for us too, as healthcare professionals. We're learning about it. And while I'd like to say, okay, this is a high-risk group and everything else, we know the elderly people and people with chronic disease are high risk. But the rest, I cannot tell you who's going to be more affected than not. You know, somebody in the same family, one person may have severe symptoms and the other person may have no symptoms. And there's just not enough data that we've collected on these amount of patients. And we probably won't have it for a couple of years. That's the way science and medicine works, sadly, is we're collecting data after the fact.
Right. I was just thinking about a follow-up question to ask you, Dr. Baruman, is the majority of the time you will hear with underlying conditions. So you hear that wording, but what does it mean to the general audience? When you say underlying, conditions, was diabetes involved? So if you can just describe that. I know for everybody it's different, but in general, people with underlying conditions are the ones that succumb to COVID-19. How can you define, I don't know, just maybe throw some examples of underlying conditions.
I think there's 2 major components to
Okay.
this. One is, are you immunosuppressed for some reason? Are you diabetic? Are you a lupus patient? Are you on steroids? I mean, there's a number of reasons why you can be immunosuppressed. Do you have HIV? A number of diseases where you can be immunosuppressed. The next one is, are you having problems with either circulation to your lungs or a problem with the lungs itself? So is this heart failure where you have problems with that? Or is this an intrinsic lung problem? So those patients I see having the highest risk. Those patients with lung and heart problems, followed by those that are immunosuppressed.
Okay.
Underlying conditions can be any number of things.
Yeah, I know.
So you have
it's
a
so
huge
big.
infection.
I know. I agree.
You have a huge infection from something else. yes, that's going to make you more susceptible.
Right.
And-
Your body's already immunized.
And if I could,
Nico?
kind of tie in the last two things we've talked about, which populations are impacted and also underlying health conditions. I think it's important to note that nationally and here locally, populations that are most impacted tend to be Hispanics and African Americans. If you look at the statistics, they are most likely to have the underlying health conditions, diabetes, hypertension, et cetera. And that's a very real issue. If you look at that same website, I looked at it today, we all know that El Paso is 84% Hispanic population. 90% of the mortalities are Hispanic. Even in our community, there's disproportionate, disproportionate impact. So we have to track that very closely in the days and years and months to come.
And again, the website that Nico was talking about is epstrong.org. So EP for El Paso strong.org. And again, there's a wealth of information there. Not only educating yourself, but if you have questions, there's a lot of Q&A questions on there as well. I didn't answer the third part of one of the questions that we had, and it's a great question because we talk about wearing masks. The eyes, how easily, because we always think of an orifice, right? Whatever the receptors are, the eyes, the tear ducts, how easily does the virus spread through the eyes is a question from the audience. And again, I know there's a lot we don't know yet, but.
Yeah, I think really most of it seems to be respiratory related. I mean, other mucous membranes can be affected, but really, honestly, the coronavirus gets in and attacks what's called the ACE receptor. So these little spike proteins, it's this beautiful little virus with those little spikes in it, that cuts onto the ACE receptor, and it's usually coming through the respiratory system. So are there other modes of transmission? Most likely, possibly, but right now for sure we know the primary is respiratory.
Okay. And in the old days, I remember you bring home groceries, you spray them or leave them outside for a couple of days and let them kind of sit there for a bit. Question here from the audience. Medications, if I am staying at home, if I was diagnosed with COVID and I'm staying at home and I'm taking care of myself as directed, they're quarantining, is there any kind of medications that I should eat? Are there some kind of foods I should eat? This is actually a great question because we really are trying to educate the population on, even if you're not feeling any symptoms and you're sitting at home, you're quarantining, what can they do to make themselves feel better? I mean, I think about the normal flu stuff, right? Have broth, this and that and the other, but
The key is nutrition and hydration.
hydration, yes.
Hydration and nutrition. I mean, really, whatever you're going to want to eat. A lot of these patients, not a majority, but a lot of them have loss of taste, or loss of smell. So suddenly stuff doesn't become appealing. So it's harder for them to eat. So the key is find something that's pleasant to you, get the nutrition in, keep your fluids going, and then monitor yourself. Am I feeling short of breath when I walked across the room? Boy, that was different than yesterday. I wasn't feeling that. You know something's different.
Right.
You've got to monitor yourself. You know your body better than anybody else, and you can tell when stuff is going wrong.
And I would strongly suggest, because we have this issue a lot with just different shows, let a couple of people know, several people know that you're at home, you're quarantined, you're tested positive, so that people call in on you.
Right.
So people check on you. You were talking earlier about chest pains, this and that and the other. If you're starting to have any kind of breathing, respiratory issues, go in immediately because things can happen really, really quickly.
I can tell you, I had a lady come in, it's an elderly woman, with a pulse oximetry of 26.
What does that mean?
That means normally it's between 90 and 100. That's why we measure how much of your hemoglobin has oxygen attached to it.
Higher is better.
Goodness.
Higher is better.
Okay. So
At
how does
26,
oxygen?
normally people are completely out or dead or just not responsive. She was awake and talking. To a mind like mine that says, I've never seen this before, it's baffling. We don't know enough about why this person with a SAT of 26 is doing okay,
Right.
and the person over here with 77 is dying. There's just so much more to learn about this disease.
Yeah, no kidding.
But the key is communication and checking on each other and making sure that we're eating, we're drinking, and we have communication to know when we're getting worse.
On that note too, and I'm sorry, I know we're going to rush through this show. It's an hour, but it's like 5 minutes. You talked about contact tracing earlier, just quickly, and I know we're still learning a lot too. But super important that if you do get a phone call that asks about that, take it seriously, and if you can tell the audience why.
No, that's extremely important. The city has established a lot of contact tracing resources. What that means is if you test positive or someone you know tests positive, what they're going to do is call that person or call you and say, please tell me where you've been. Please tell me who you've been in contact with.
And don't lie, like you said. You could be embarrassed that you did do this, but tell them it's so important.
Please tell them you are potentially saving a life.
Right.
And that's not a cliche. It's not a trite statement. It is quite literally the truth. contact tracing is only as good as people who answer the phone and are honest. The city is trying. People are trying. Hopefully, we can make that better.
I don't know if this is an important question or not. Are all those going to be 915 numbers? The reason I'm asking is that if I have a number that's not 915,
That's a great question.
often
I
I
don't
don't answer it. I don't know either.
I don't know.
We'll find out. We'll
Yeah.
find that out, and we'll pop it onto the website. Only because I know myself as well. Dr. Baruman, because we are going up, think of some stuff that you all really want to get across tonight because time is flying. Vaccines. Anything you feel comfortable talking about with what your idea of,
I think what we've learned over time is vaccines work.
okay,
We've seen it with polio, we've seen it with smallpox, and yes, there are side effects to almost every single vaccine. I got a Shingrix vaccine for shingles. I got fevers and chills. It's one of those things. But listen, this is the way we have saved lives in the past. If the vaccines will come out eventually, I promise you, the availability will be limited initially and will cover those people at highest risk. But I tell you over and over again, we've seen this saves lives. We've seen it change smallpox. We've seen it change polio. We see it change influenza. Okay, so the key is vaccines are safe and effective,
right,
and they have not been. There's nothing to think about autism or any of that stuff.
Right.
It's not been proven.
right.
The key is it's safe and effective, and if it comes about, that's the best way of us getting control of this.
And I will throw out right now a plug for the good old-fashioned flu vaccine.
Absolutely.
And reason why, maybe talk to the audience why, because that's just one more thing you have a little bit of defense for, and it also kind of rears up your defense systems, right?
So the vaccines do rear up your immune system. The issue with influenza is also a respiratory disease. So the last thing you want to do is have an influenza when you know you already feel lousy and you have troubles breathing, and then you get COVID on top of it.
Right.
If you get a double whammy like that, your risk of getting very, very ill goes up dramatically. So the key is, if we can protect ourselves from a known process like the influenza, let's cover it. It's already
Right.
out there. Let's cover us for that. At least that cuts down one component of what we're going to be dealing with if we should get COVID.
Okay. And the good thing too is I see and hear all over the city flu vaccines for free. You know, so if you're not insured or whatever, I don't want to, again, I already, in any place that gives them, call and find out if there's a way to get them for free. There are all kinds of ways of getting them for free. Actually, El Paso Strong 2 has that information on there as well.
I will
Yes,
tell you
Dr.
that much like a lot of the other things, we are proactively preparing for the vaccine when it's available. So hospitals in town plus physicians have already the chance to apply to be considered as someone to dispense the vaccination. I just signed the form yesterday, and I'll know in the next 10 days, and then I'll get approval as the Hospitals of Providence to dispense that. So we're working through with the government already on this, working through which the phases are going to be of who first responders like Dr. Baduman would be first in line. And so we'll make sure we stay ahead of that for the community's sake. So when the vaccine's available, we'll be first in line.
So I'm going to ask you, if you don't mind, to just explain how preparing is. I mean, different dissemination points. What is it that you are preparing for?
Yeah.
How to give them out, obviously, to frontline workers first, et cetera.
Yeah, that's a great question. So I'll give you just a couple of examples.
Okay.
One is the actual vaccine, but depending on whose vaccine it is, it's Pfizer, AstraZeneca, someone else's, they're not all identical. Some require different kinds of refrigeration. And so let's say it's Pfizer's. It's going to require a certain kind of refrigerator. Okay? Then we have to prepare and make sure we have that refrigerator in the hospital. Then let's put that to the side. Let's take how they define first responders. Let's say it's physicians and nurses. That's obvious, but respiratory therapists, maybe. People in dietary who go into the room to feed people, environmental service. In advance, we're categorizing all of our employees so we know exactly how to phase this and distribute this once we know who. So these are the kind of things we do to make sure in advance so when the time comes, we don't lose time.
I love that. And this is kind of what you were doing too, so that you guys are pretty, you know, yes, we are overwhelmed in some ways, but you're a lot more prepared than if you didn't try all this ahead. What I'm trying to give you kudos. And so question here for Dr.
I want
Berman.
to talk
Yes,
about
please.
the vaccines
Nico.
also.
Yes.
Is we, from El Paso Fire, we trained a bunch of our paramedics to give vaccines.
Oh, perfect.
So
Okay, there
now
you go.
we're
That's another
giving,
delivery.
we're giving another way of getting our paramedics to actually give vaccines. So
Great.
another way to get that out there in the community.
So there could be health fairs, there could be, you know, this day at the park, that day at the school, this day at the, that's fantastic. Dr. Baruman, before I give you guys just free rein on what you guys want to talk about, therapeutics really quick. So question here from the audience is, those people who are in the hospital, what treatments are they being given, or what seems to be working for people that have COVID in the hospital? Antibiotics is a question, but it's a virus, so it's a different thing. I know it's always a thing, but in general, what are you seeing works? And I know everybody's different again.
So what we're seeing is a lot of this, what we're treating is what we call COVID pneumonia. So it's the lung that actually gets infected. We do treat these patients with remdesivir if they're early on, and it works quite well. We do use antibiotics because we're finding that sometimes they have a combined infection, and we've seen good outcomes. We're not sure about the whole science of it, but we're seeing good outcomes with it, so that will continue. The other thing is dexamethasone, or a steroid.
Right,
okay?
that's the other, okay.
And we also have convalescent plasma, which for people who had been infected,
Right.
we take their antibodies, we give them to those that are infected, and we have some help there also.
How is that coming along with people who have had COVID and donating? Is that something we should make a plea for tonight?
I would
since we're on the
always
air?
ask, we're always
There's the
short
camera.
on
Tell 'em.
convalescent plasma. If you have had it, please go in and get your convalescent plasma done, okay? Get it drawn, help the rest of the community, okay? I think it's very, very important.
Excellent. I'm very glad that we got to say that.
And if I could add
Yes.
an emerging therapy, just emergency use authorization a few days ago, antibody infusion, which will
Okay.
be coming out. Now, this is one that I want El Pasoans to know. It's an example of how El Paso is helping to lead the way for the country, quite literally. This just was approved. Right now, in collaboration with Border Rack, we haven't talked about Border Rack.
Oh,
by the way.
Border Rack,
Border
yes.
Rack,
Huge.
I mean,
Rock stars,
Wanda
right.
there is the rock
Yes.
star. Wanda is leading the way for the community. Make no
Right.
mistake, she's the leader. Working with Border Rack and state and federal agencies. Right now, as we speak, there are people working on establishing a community-based infusion center that will be able to administer this brand new therapy in an outpatient setting. Now, here's the thing. Nationally, there's only 80,000 doses. In the state of Texas is only going to have an initial allocation of 5,000. So that's not very many, but get this,
Right.
because of this community infusion center, which is a pilot, the only pilot in the United States for this, we're getting an additional 1,000 just for El Paso.
Go El
So
Paso.
this is happening right now. Hopefully in the next week we'll set this up. But I wanted to throw it out there because we are trying to be on the leading edge of the therapies that are available.
Okay. And we're at 10 minutes now. It goes fast. So we've got so much here to talk about. What have we not covered yet that you really want to cover?
Well, gosh, I mean, there's a lot. You're right.
There really
There's
is. There's so much.
I
Yeah.
just- I
And you're
need
going to
to-
get the same question.
I need to make sure that I call out all the support that we've received from state and federal and city agencies. Really, I mean, from the mayor to the county judge, all the way up to the governor and to federal agencies. And just let me give you an example. William Beaumont, right? I think as of this morning, they've accepted over 100 patients who are military beneficiaries, and the VA, they've accepted over 100. We have an air evacuation system with fixed-wing aircraft that has evacuated over 70 patients out of El Paso and taken them to other hospitals. I mentioned the staffing, over 1,300. 6 ambulatory mobile units, right? 2 disaster medical assistance teams.
That are coming in
Coming
from
in.
the outside to help
U.S.
us.
Air Force in our hospitals with these teams. I wish people knew how much we were being supported nationally on this. So I just had to call that out as one thing. The other thing I want to call out is how well the healthcare systems in El Paso are working together. Whether it's the hospitals of Providence, Las Palmas del Sol, University Medical Center, me, along with our colleagues, we speak every day. We're not trying to out-hospital each other on COVID.
Thank God.
We're trying to
Yeah.
work together, develop a good solution for the community, and that doesn't just administrators, this is physicians, this is staff members. Everyone's trying to work together, doing it very well.
I love hearing that because this program is a lot about teaming. Whatever teams, because no one doctor can cure anybody by themselves, and it's really nice to have everybody coming together. Dr. Baruman, there are still questions here, but anything that you want to stress, either it's something we haven't talked about yet or something that you'd like to re-stress, and I'm coming back to you too because sometimes you think about things when the other person's talking.
I think it's really about maintaining our general health.
Yeah.
It's mental health. I mean, it's depressing to be by yourself. It's depressing to not have these communications. The key is you got to focus on what those things make you happy and what's positive for you. It's a matter of keeping those communications open with your family members. making sure that if you're feeling desperate about something, you reach out to somebody. There's a bunch of stress in this world right now. There's people losing jobs, there's people losing family members, and there's a fear of the disease. The effects on people's mental health really affects their immune system also. And so the key is realize if you're getting into that state, reach out to get some help.
Right.
You know, because the only healthcare issue is not just COVID right now. It's all the other diseases that we deal with, and on top of that, depression and isolation.
Right. I'm going to throw out the, again, there is a COVID hotline for those of you that would rather use a telephone, area code 915-212-6843. There is a live person, I understand, on the line. If it's not COVID related, if it's mental related, ask the question. Also, epstrong.org, www.epstrong.org. And Nico, I'm sure you can give out the Hospitals of Providence website really quick too, and a telephone number just for people to be able to call.
thehospitalsofprovidence.com.
Nice and easy.
Nice.
Use the word thehospitalsofprovidence.com.
Yep.
Telephone number, you can do a Google search. I
Do
don't
a
know if you
Google
have
search.
it.
That's the best way.
Okay,
Just
I was
look
going to say
online.
there's so many
Nice
numbers
big
out
deal.
there. So many numbers out there. And so, again, we only have a couple more minutes, but I would love to expand a little bit more about what's coming in. And I know we started talking about the Civic Center earlier. Is that the only place right now? I know that outside of hospitals, I don't want to go there, but I feel like I have to let people know how heavy this is, that we have refrigerated trucks coming in too, because the people who are passing away need to be respectfully stored as well. I say that not to scare people, but when we're talking about the masks, we're talking about Thanksgiving coming up. You have family, you have family. I want to know what you guys are doing for Thanksgiving so that the world out there knows, okay, you know what, they're going to social distance. You probably have a mom and dad you could go visit, maybe you're not, et cetera, et cetera. Maybe you can talk a little bit about that because that's so important because we are a familia type of a society.
I spent 30 minutes yesterday talking to my mother in Kansas, not only telling her that, of course, we weren't coming, and I'm the youngest of 5 kids. They all want to be there. Not only telling her that, but also hearing her cry on the end of the line, not because I wasn't going to be there, but because I was telling her why it was so important not to be around my siblings and her grandkids. And I told her, and I don't mean to be theatrical, but it's important. I told her, I said, you just sacrifice not seeing them right now, because if you were to go into the hospital, you would not see them for the duration of your stay, any of them.
Ever again.
So it's a choice you're making. So my family and I mean, I don't say unfortunately because I love my family, but me, my wife, my kids, at home, enjoying the dinner, being thankful for what we have, and that's our health. So that's what we're going to do.
Excellent. Dr.
Same
Brewer?
with us, the three
Okay.
of us just having our little turkey and sitting at home, and then, you know, having a little Zoom with our other daughter and our other family members. I mean, we actually had a Zoom family member meeting this last Sunday. It's great. It's still some way to
I got to
communicate.
tell you, it's become, we're in the business world. Nico and I have a lot of the same meetings together and people at the same meetings. It is so efficient, you know, and the thing is that because you're so concentrated on the person in front of you, like if you're talking to your mom, I don't know if it was telephone or if you had her on the video screen, you can't help but completely focus on her the entire time. Versus when you're together, you're doing this and you're doing that. So it really is, it's efficient, and I say that, gosh, why would you say that in the world of family? But it is, because you're having real conversations versus throwaway type conversations. We have a couple more minutes here. I want to give out a little bit more information. Actually, I did want to say that we have, I didn't want to throw out another number, active cases right now in El Paso. Active cases are 29,700. Recovered cases are 37,000. So when I say that, realize we've been in this again for 8 months. As I said at the beginning of the show, the first time we talked about COVID on this program, the El Paso Physician, was on March 12th. That was exactly 8 months ago. We did not have one case diagnosed in El Paso at that time. So since then, we have, again, 37,000 that are recovered, 29 that are active, and ICUs are filling up. So please stay at home if you do not need to go out, and wear your masks. Eyeglasses if you can.
Yeah,
Nico?
and I have one more thing I have to say, and I want to talk to the camera if I could.
Yes,
which one
let's
am I
find
going
out.
to?
Whichever one's got the red light on. So this one right now.
I have to say thank you, Dr. Berduman, thank you to the physicians and the staff. They are tired. They are fighting through it. They're proud of what they do. They're proud of each other. I want to say thank you. because what they're doing is incredible. It's heroic. I wish people could know exactly how hard they're fighting every day for El Paso.
Yeah. And this is, it's funny because that's how I was going to do my closing. Thanks, you just totally stole all that. No, but it matters. When we're talking about bringing people in, that's one thing. But also the people that are coming in are also helping other communities and are coming from other communities who have had hotspots. So when you see someone that has scrubs on, that you know is just throw a nice word to, and if they look haggard or if you are getting some kind of treatment, there is something that, oh gosh, what were they calling it? Passion fatigue, which is when nurses, doctors, et cetera, you want to rally around whoever is sick and help them out. And if they get a little short, it's because there's so many other things that are going on. When we were talking, I just had another question here, and I'm was it from the audience? Sorry guys, this is going so fast. The El Paso County Medical Society, we were talking about PPE distribution and working with all the partners every day. So if somebody needs to get some kind of PPE, which is personal protection equipment, do you know where they could go? I know they're available everywhere, but is there a place that they're available for free, if they're masks for free? I know that the El Paso County Medical Society, if this helps, is distributing PPE. So if you need to, you can Google El Paso County Medical Society. If I had the number memorized right now, I would give that to you. Also, their website is El Paso County Medical Society, so epcms.com. And you can go there and find out where you can get some PPE materials. And I'm saying this also for healthcare providers out there, because it's not, we're also looking at dentists. You're also looking at other healthcare providers that may need this equipment. And I'm talking to you if you're sitting at home, that the El Paso County Medical Society is happy to get some of that information to you. Taking a deep breath, I want to say thanks again to our medical students. You guys rocked it tonight. Thank you very much. There weren't very many misspellings on here, which is great because it always helps me quite a bit. Where can we go to get free flu shots? Call the El Paso County Medical Society for free flu shots, and then also, call them and we'll get that information to you. I have 30 whole seconds, so you can watch this program back on pbselpaso.org because sometimes it goes so fast and you may miss what we're talking about. You can also watch it back on the El Paso County Medical Society's website, which is epcms.com. This has been a special program on COVID response to the community from our great hospitals here in El Paso and our healthcare community. I'm Catherine Berg, and you've been watching El Paso Physician. Good night.